Welcome to the Gorgeous Glow Skin Show. So good to see you guys this new year. So hoping you already have your plans and what you have in mind to accomplish this year. So I definitely have mine. But last year was awesome, and I'm hoping you had a good last year also. Anyways, welcome to the Gorgeous Glow Skin Show. I'm your host, Dr. Sonia Johnson. I'm a board-certified dermatologist and creator of the GRxSystem. I help women who want to have even and clear skin tone with increased confidence. If that's you, you're at the right place. So today we're going to talk about the adverse effects of dermaplaning. Dermaplaning, as you recall, is a technique in which it helps with to unmask your gorgeous, okay? So what it does is you have a blade, esthetician preferably, will have a blade perpendicular to the skin, so at 90-degree angle, and they make little, almost in scratches across your face. So, but in small distances, so it's a controlled procedure in which they're not, scraping across the face too far, so they can control the area. But anyways, they make these little short scrapes across the face. And what it does is the blade touches the skin, but it doesn't cut the skin. And it helps exfoliation, definitely gets rid of those very fine hairs that people don't want. And by doing that, when you're done, you'll notice your skin is really smooth, and it helps microscopically remodel the skin, but it helps to get rid of that dead skin, and therefore, like I said, unmask your gorgeous by the exfoliation causing your skin to come through and in its natural tone, as well as with just your skin, nothing extra on it, such as dead skin that tends to build up and causes clogged pores, gets rid of all that. But regardless, with any procedure, there's always the problem or the chance that you can have an adverse reaction or adverse effect in this case. So this is a natural procedure because there's nothing on a blade. It's just a blade going across the skin. However, there's always a chance you can get it nicked. Your skin can get nicked. We're talking about a true blade. However, there are certain size blades that the esthetician can use, so that aspect of getting your skin nicked is diminished. Again, you want someone who's experienced, who's done a lot of these procedures. So therefore, the chances of that happening to you will not happen. However, if you do get a cut, usually it's a minor cut, it should be. And you want to keep it clean, keep some type of Neosporin or medicated ointment on, like a triple antibiotic ointment to help the area heal, but it should heal fine. However, no one wants that, of course. And then, of course, another adverse effect of getting this performed, because it is a treatment that is going to exfoliate the skin, is getting it too much exfoliation occurring. So you're getting rid of the dead skin that you don't want, but you're taking it even further, and it's causing an abrasion to the skin, not just a cut, but an abrasion. And therefore the skin is really sensitive. And so when you put products on afterwards, you notice a sensitivity or burning of your skin. So that just tells me then that too much exfoliation had occurred. And this is something that when this technique is being performed, you want to make sure that area is you're not going over that area too many times. Usually once or twice is enough, but not a lot of times, because that will take too much skin off, as well as the dead skin, but too much of your skin, and it can cause an abrasion. Or if you get this procedure done too often, meaning like let's say once a month, instead you're doing it every week or something of that sort. And another reason why you can have an abrasion or too much exfoliation, if you're using products at home, go get the procedure done. Don't tell the esthetician, and she doesn't know, and therefore she's using this blade and causing more problems. So products that you want to avoid or you want to stop probably a couple of days or several days before the dermaplaning is your anything that's going to exfoliate the skin. So like your salicylic acid containing cleansers or gels or creams, you want to stop that. Definitely retinoids, period. So you have your retinol over the counter, tretinoil over the counter, and then there's the retin-A products. In that category also includes your, let's say, adapalene, your epiduo, products of that sort for acne that you use at night. Avoid all that. Or you need to talk to the esthetician or whomever is going to perform dermaplaning on you. You need to talk to them and let them know what you're using. And then ask them how many days before this procedure you want me to stop the product so we won't have a problem when I get this procedure performed. And definitely even after you have dermaplaning performed, you want to inquire, how long do I need to wait before I start using my products again? Because your skin is going to make, shed the skin. It's going to make new skin in that area. And you're going to have more dead skin produced. But, again, if you're using your products along with dermaplaning too close together or too often, you're not giving the skin time to repair and heal itself. And therefore, that will cause your irritation or that mild abrasion that you would feel, and therefore the burning sensation and even discoloration of the face if it's too abrasive, okay? So this is some things you just want to keep in mind when you're doing dermaplaning. And like I stated, make sure you have a skilled esthetician who does this procedure, as well as making sure whomever you see know about your products so they can tell you when to stop and when to resume using your products after a dermaplaning procedure is performed. So any questions? Okay, well, thank you for joining me. Again, I'm your host, Dr. Sonia Johnson. I'm a board-certified dermatologist and creator of the GRxSystem. I help women who want to have even and clear skin tone with increased confidence. If that's you, you're at the right place. So if you have any problems or adverse outcomes with dermaplaning or any procedures, by all means, you can have a virtual dermatology visit with me, in which I can talk to you at any place of your choosing. And again, that's on Saturdays. So if you're interested, go to yes.iwantclearskin.com. Yes.iwantclearskin.com. Take care. Thank you.